Hello, everybody. This is Terry with Premom, and we have special guest again today, Nurse Linda.
Hello. Hi, everybody.
What's great is I think this is your first time live in the Facebook group because we tried you live in Instagram last time. So welcome to the Facebook group.
Yeah. Hi, Facebook group. Love Facebook groups and a bunch of them. Very nice.
Today's topic is going to be, we kind of left it open, but we narrowed down a little bit. We said tracking, PCOS, IVF, because these are some areas that Nurse Linda likes to talk about. But if you have other questions, please ask those as well today. We'll get in as many questions as we can. And we do have some advanced questions. But before we go into those questions, for those of you who are new to Nurse Linda, why don't you talk a little bit about yourself so we know who you are?
Sure. I am... Short answer is I'm an infertility nurse. I've been in infertility nursing for about 21 years now. So mostly I focused on higher level IVF type stuff. But of course, in getting to that point, I had to work through all of the lower level infertility as well. So this is what I've done. Most all of my career was infertility. On top of that, I did have a bunch of my own infertility stuff. I did the course of doing, this is like going back, I don't know, 25, 30 years ago, doing just timed intercourse, IUIs, leading to IVFs. I was lucky enough, I am classic PCO person. That is my diagnosis. I was lucky enough to have 3 kids naturally. They are all 10 years apart, just because that's infertility for you. I wasn't successful at my infertility treatment, though, again, that was about 25 years ago, so it wasn't nearly as successful as it is now. But of course, I'm very happy for where I am and what I do. So I love this. This is the best part about infertility, if one can say there's a best part, is helping the patients, because to me, creating families is the most important thing that can be done in this world. And so I'm always so happy to be a part of that and just helping people understand more about this. It's so technical sometimes, and science, and we don't even know sometimes how our bodies work. So it's great to talk with people and find out more about this. And my goal is to empower all these, women and men to understand more about what they're going through, to try to, lessen the stress a little bit. So that's what I'm here for.
Thank you. I love that. And I love hearing stories from providers who've gone through it themselves, because I think it really does help give you that perspective from both sides. Really powerful.
Mm-hmm. You are right.
Let's jump into our first question. Is it true that females with PCOS will receive incorrect readings when using OPKs?
Oh, good question. I'll tell you, and again, I'm going to do mostly probably about my own experience, is it's tough sometimes. Again, back when I did it like 30 years ago, you would buy an OPK test kit. Maybe it wasn't expired in the back of a Walgreens somewhere, and you get, 3 test kits in it. That's going to be difficult for a girl who's very regular. For somebody who's PCOS like me, who maybe has a period back then, 3 times a year, how was I supposed to use these kits? When I first saw Premom and what they offer, I was like, where were you guys 30 years ago? Because I certainly could have used you. What's difficult is a couple of things. If you're truly PCOS and have those random periods, well, when the heck are you just supposed to pee on a stick every day for 90 days and hope you see something? That's one way to do it. But then that's kind of cumbersome and a little bit difficult and frustrating, because you just keep seeing negative after negative, because again, we randomly ovulate. The other thing that's complicated is often people with PCOS have elevated LH levels or luteinizing hormones, just because we just do. Well, the ovulation predictor kits, that's what they measure, is LH. So I have real funky LH levels. So not all the time, but some women, probably those more like me with this classic PCO, it can be difficult to try to do this at home. And that's why, again, for somebody like me, I did end up having to, seek out medical assistance, because it is difficult. And I wish I could tell you that's not the case, but I'm not going to be misleading. That is the case, you know.
Our next question is, can consistently having irregular or very long cycles over 45 days with LH showing multiple attempts at ovulation be a sign of PCOS?
Yes. That is. If you ask me, well, what would it look like if a girl with PCOS were doing OPKs? And I would say, well, she may do it for 30 to 60 days and not see anything real, like, you know, peaks, but she might see levels of LH going up every now. Well, that's what's difficult, because the PCOS problem is strictly chemical. It's nothing physiologically wrong with us. Our eggs are fine. Our ovaries are fine. They're chock full of eggs. Our uteruses are fine. We can have babies, no problem. It's the chemicals, the hormones. And of course, what do OPKs do? They rely on hormones. So yeah, it could be. I mean, I wouldn't use that just to diagnose it, but that is the number one symptom of PCOS is irregular periods. And of course, there's always degrees of being PCOS, right? You don't have to, like anything, right? Endometriosis, any of those things. There's always a spectrum of how much you suffer from it, so to speak.
We have a question about tracking. If I can't track my CM or BBT, is there any other way to confirm ovulation?
Well, to confirm, using the word confirm ovulation would actually be progesterone testing. I'll be honest, even the LH test doesn't confirm ovulation. Now, a BBT will confirm ovulation, but of course, the question said, what if I can't do that? You know, so to actually confirm it, BBT would confirm it, or a progesterone blood test, or there's also urine tests, I think, for progesterone now, and that would confirm ovulation as well. Because again, just because you have an LH peak, that means you have an LH peak, which means most of the time, I mean, even greater than 90% of the time, you are going to ovulate in the next 24 to 36 hours. But keeping in mind, what does it mean exactly? It means you had a surge in LH. There are times when people do grow follicles and don't ovulate. That is very, very seldom. But again, being technical, confirmation would be the BBT or the progesterone test. Does that make sense?
Yeah.
Okay.
Let me see. I think that was it for the advanced questions. Let me switch over to live. And if you're out there watching, we're answering your questions live. So go ahead, shoot your questions. Let's see.
And I'm an open book. So if there's anything, it doesn't have to be on topic. If you just feel like I got to ask, please don't hesitate.
Let's see here. Here we go, live. All right, we have 20 people on, so ask away. Let's see. Don't think anybody's asking right now. So let's wait a minute while people respond.
Sure.
Do you have any other tips about just tracking in general? Because I know that's the biggest topic in this group.
Well, you know, I'll give you a little feedback. When I do consults for clients on Premom, that's probably I'll get the really cute little, the charts and all of that, and the tables with all the info. And, they're looking for advice on how can I make this a little bit better? A couple of things is, and I think I've heard this before, is I do recommend doing the LH kits a couple of times a day, because that LH surge happens rather quickly. So if you were somebody who, let's say, always did their LH kit at 4 p.m, which, by the way, it is recommended to do the LH kits later in the day compared to like our pregnancy tests and those, do that with the first morning urine. The LH kits are actually better done in the afternoon. So let's say you do it every day at 4 o'clock, but maybe your body's going to, ovulate at 6 a.m. Well, you may just miss it, because you do it at 4 and it's not showing yet. And of course, you're not planning on doing it until 4 o'clock the next afternoon, which it will be too late then. So trying to do it every 12 hours well, certainly you will catch an LH surge if there is going to be one. So I would say doing it a couple of times a day and making sure you do it in the afternoon is one of those times at least, or at least later in the afternoon. Also intercourse. So this seems like this would be a no-brainer, but it's not. Different people have different opinions about how often to have intercourse. As long as you don't have a really severe male factor problem or a severe sperm problem, and of course, I recognize a lot of you aren't going to know if you do or not. Though it's one of the things I try to recommend. You can do at-home semen analysis now, is while you're on track doing these, I would recommend that your partners, the husbands, the men out there, do this, because that just in case you're the male who's got a severe problem where you're not, you're just not going to get pregnant at home, at least not for a long time. We can save that girl a lot of heartache and a lot of problems by recognizing that up front. Why wait, make her go through 12 months of this, up and down, the emotions all over the show, and he's got a severe male factor problem, and we weren't ever going to get pregnant like this anyway. That would be great to know in the beginning and not at the end,
That's a good point.
And again, it's okay if you have a little bit of a sperm problem, because you can still get pregnant with that. Just might take a little bit longer is all, but it would be good to know. So for most of the men out there who don't have severe problems, I try to recommend intercourse every night for at least 3 nights. So you get the LHP, intercourse then, you're probably ovulating the next day, intercourse that night, and just to put the cherry on the cake, let's do it one more time for the night after. So in other words, I do certainly have intercourse when I ovulate, but let's have intercourse the night before and the night after as well. So that's it. And I tell my clients, if you don't want to have intercourse the other 27 days of the month, that's fine with me, but try to have it those 3 days. Because I do notice when I get these beautiful charts that the intercourse is like, oh, I had my LHP, so we had intercourse that night and that was it. Well, okay, honey, you might not be ovulating for another 36 hours. There might not be much sperm left in there, to try. You need a lot of sperm to get pregnant. So that's why I recommend, that's how I recommend intercourse. Again, if there was a male problem, I might recommend in every other night to let him save up a little kind of thing. And then quite honestly, it's not always possible for a man to, okay, you just want me to have intercourse whenever you demand. That doesn't always work, but again, it's always nice to know what to kind of shoot for to optimize things. And that's mostly what my consults are about, is just trying to optimize things and understanding some of these, simple principles type thing. But those are probably the biggest things that I would say we talk about in consults.
Great. Yeah, and we do have some live questions coming in now. So thank you, everybody. Here's the first one. I had a chemical pregnancy the very first time I got pregnant. Is this common? What causes a chemical? Okay, good question. When I first started out in this business, I was really confused about what chemical pregnancy meant as well. It's like, is that like a fake pregnancy or something? Because they weren't calling it miscarriage. So like, would I tell people, did I have a miscarriage? And what does this mean? It's a miscarriage. That's what it is. It's a real pregnancy, and it's just another way to say miscarriage. Now, in the field, we say either chemical or biochemical. And basically what that means for us is I have only seen the pregnancy chemically. I've seen a positive pregnancy test, a beta HCG. Of course, in the doctor's offices, you get numbers, it's 26, and then it went to 52, and then it dropped to 30, and then it went down to 0. Well, she absolutely 100% got pregnant, but we lost the pregnancy before I could confirm with an ultrasound that a sac was there. We tend to call those clinical pregnancies or miscarriages because I saw the sac, but the truth is they're all miscarriages. So that way, it's nothing special about being chemical. It just means it tends to be an early loss. Mm-hmm. So why does that happen? And is it common? Miscarriages? Yeah, they're real common. Like 1 in 4 pregnancies on average will be a miscarriage. Oftentimes, a woman might not even know she was pregnant. Maybe her period is 3 days late and she didn't even get around to doing a pregnancy test yet, but it was 3 days late because she did get pregnant, but she miscarried.
And the reason is most often it has to do with egg quality. Most often it has to do with the egg. It's either the egg or the sperm or the uterus. That's it. It's one of those. And generally, rarely is it the sperm, because sperm are all young and spunky and they've only been around for 2 or 3 months, because men make sperm every 2 or 3 months. That's why old men can still have babies. Whereas us ladies, we're born with our eggs. So our eggs are as old as we are, and we all know that our body parts, they don't work as well as we get older. Our joints don't work as well. Well, your eggs aren't any different. So that's why it's not unusual, even if you're young, even if you're 27, you easily can have a miscarriage. Now, you're much more likely to have a miscarriage at 37 than 27, but still, your eggs are 27 years old. There's nothing wrong with you at all. That was just not a good egg. It was good enough that you got pregnant and it snuggled into your uterus for a minute. It did. So we know you can get pregnant. That's a really good thing. But this wasn't the one. And most often it's just not a normal pregnancy. Now, you can lose it early on, and we call that a chemical pregnancy. And in the first trimester, in the first 12 weeks, are when most miscarriages happen. But of course, they can happen later. And of course, people can actually deliver abnormal, right? I mean, I say abnormal, but Down syndrome, these kind of things, these are just, again, abnormal chromosomes that came from abnormal eggs. And yet those women carried those babies and those people are born. But most aren't. Most are lost in miscarriages. It doesn't become an issue until maybe you've had 3 or more miscarriages. And I would say like in a row. Like if you miscarried and you had 2 kids and you miscarried again and had your 3rd kid and maybe you had another miscarriage, I'm not worried about you. You're having babies. But if you can't, then you have to start looking into things like, is your body rejecting the uterus? Are there immune issues going on? It becomes more complicated. But again, don't even give it a thought until you've had, at least like 3 miscarriages in a row kind of thing.
Okay. Then she had a follow-up question. Is it true you're more likely to have a successful pregnancy after a chemical?
Well, that is a really interesting question, because that is exactly what happened to me. But the answer to that is no. There really isn't anything scientifically based that makes you be able to get or retain a pregnancy if you just had a miscarriage. There's different schools of thought out there. And of course, that darn internet, which we love and hate at the same time, sometimes it tells you, oh, if you miscarry, don't try for another couple of months, or they'll say, oh, if you miscarry, try right away because your body's in the mode. Well, heck, what am I supposed to do? I've got 2 opposite, pieces of advice there, but there isn't anything biologically behind either one of those. Again, personal story. When I got pregnant with my 2nd child, again, it was like a miracle because I never knew when I was going to ovulate. So it would just be boom, you'd find out. Usually I'd end up like I would be going on a diet or something. And I'd say, let me just make sure I'm not pregnant before I do this. And that's how I would find out I was pregnant. Well, I got pregnant the 2nd time, thought again it was my miracle because I'd already failed my IVFs. So I thought, well, this is just a miracle baby. And I got to about 11 weeks and heartbeat's fine. Everything's great. And then I started to bleed a bit at about the 11-week mark, and I ended up miscarrying. I was devastated. And about a month later, I went back to my infertility clinic because I thought I was done. I'd already had 1 child, and I said, I'm not going to go through IVF again. But I went back to my infertility clinic, and I said, I'm bitten by the bug. I want to try again. And she said, okay, well, we'll wait for you to get a period, and that'll be the start of your cycle. I said, well, don't wait for that. I'm PCO. I'm not going to get one. And she said, okay, well, we'll just give you Provera to bring on a period. And some of you folks out there with PCOS, you've heard of Provera. It brings on a period. And I took it, and it always brings on a period. Didn't bring on a period this time. And my boobies started to hurt. And that only happens when I'm pregnant. And lo and behold, I took a pregnancy test and found out I was pregnant. This was only about a month after my miscarriage. And of course, I freaked out because I took the Provera, but Provera is just progesterone, so that didn't hurt anything at all. And that pregnancy was just fine, and that ended up being my real miracle baby that I had. So I think that was just, again, a fluky thing. But so no, it doesn't. You know, you don't necessarily have to try not to get pregnant, but you're not necessarily going to be more likely to get pregnant either after a miscarriage.
Okay. I think we actually have another miscarriage question.
Okay.
I'm 41 with 2 miscarriages, and when she's tracking, the second line never is as dark as the control line, and she's wondering if that's okay.
Well, I mean, it depends on, of course, what the Premom test is or the easy at home test is saying. I mean, is it saying it's peaking, or what is it saying? You know, again, the miscarriages shouldn't have anything to do with that. And again, I'm not sure when your miscarriages were, but like I said earlier, you know, 1 in 4 pregnancies end up in miscarriage. But remember, that's an average. You know, a little gal who's 24, you know, they might be 1 in 8 pregnancies miscarry, and it might be the gal who's 40, it's 1 in 3 miscarry. So certainly you're much more likely to miscarry once we get in our 40s for sure. And again, not anything that's a surprise. I don't know why that would necessarily change your ovulation sticks, though, or why. Again, I don't know if you're ovulating, if you're doing a BBT or temperature, but again, that'll help. Even if we had to sacrifice a month, you know, really, because you could always have sex, but you know, do your BBTs, because when you're asking us, or you know, did I ovulate? Is this the color stick? Well, do your temperature. It'll tell you if you ovulated. So that way you might learn, oh shoot, my temperature went up and stayed up. You know what? Turns out for my body, that is me ovulating. And now you know going forward, because remember, these are all customized for you. And of course, these tests are great because they really try to follow what your body does, you know, so they're intelligent, so to speak. So yeah, I would, you know, that's what I would say about that.
Okay. Let's see. This is going to be my first month after 5 months of letrozole. What's the likelihood of ovulating, I think, on my own? And they have PCOS.
Okay, well, I'm going to assume you took the letrozole because you're not ovulating on your own or not ovulating with any regularity. Did the letrozole make you ovulate? You know, with PCOS, sometimes Clomid and letrozole don't. You know, you don't respond to that. I didn't respond to that. But again, it's not going to change the PCOS, you know. So just because, you know, you ovulated when you were on letrozole, and once you go off it, it's not like your body's like, well, okay, I got this now. I know what to do. Doesn't work like that. You know, it's just like women who have PCOS and they're on the birth control pill. Well, we have periods every single month. Don't we just look like Irregular Nancy with our periods? Well, no, because those are birth control periods. It's not your body. When I go off the pill, I'm be right back to being PCO again. So no, those kind of things aren't going to necessarily change your diagnosis.
Can you test negative and still be pregnant and not know it when you have PCOS?
No, that would have nothing to do with it, right? So the first part of your question is, can you test negative, you know, taking an HCG test, can you test negative and still be pregnant? Well, I mean, theoretically, yeah, maybe that little baby's nuzzling in as of yesterday and you don't have any measurable HCG yet. So, you know, but gosh darn, they do these tests now. They're set to be done so early that they almost catch that. But technically, certainly there is a curve as it raises. So it's going to start out very, very low so that a kid might not pick it up. But because it almost doubles every couple of days, within 2 days, it would be positive if that were the case. But again, PCOS has nothing to do with that. PCOS won't do anything with HCG tests, won't interfere with them at all.
Okay. Let me see here. Can using a heating blanket daily on high cause issues with getting pregnant?
Okay, well, let's talk about men. because we know men make their sperm in their testicles, which hang outside their body. And they hang outside their body for a really good reason, because that little sperm factory can't be at 98.6. Sperm don't do well with that. So sometimes you'll hear about with men, if you're trying to get pregnant, they might tell them to, stay out of hot tubs and that kind of thing. And that's what I'd be going for, is the heat when it comes to a man. I'm not so much worried about it with a female, because again, our eggs are very protected. Though I would say once you're pregnant, we have to be conscious that we have a little baby growing in us now. And I would maybe, again, you can use your electric blanket, but I mean, I would just make sure we don't maybe have it, cranking kind of thing. But that could be a relevant thing for men. Okay. But remember, even if a man screws up, and they're probably gonna, maybe he hasn't quit smoking like he told you he was gonna, or he's still drinking a heck of a lot, or anything like that, or he went on the Tour de France bike ride, or he sat in that hot tub for a while. They make new sperm every 2 to 3 months. So a man can always reverse whatever might have gone on. That's why, again, a man really can straighten up their act and get their sperm better, because he's going to make a whole new batch of it, kind of thing. Mm. Like men on hormones, men bodybuilders, they like to take testosterone or any of those things. Well, those will knock sperm right out. He will not have any sperm if that's the case. But again, go off that stuff, and within 2 to 3 months, he's going to start making sperm again. So again, men have it fairly easy, but it's good that we should understand what goes on with men, because again, I'm almost sure most men do not understand how their bodies work. That's not a slight on men. A lot of women don't understand how their bodies work until they have to find out how it works, But yeah, so it's good for us to know that as well.
Yeah. Is there a higher chance of a chemical pregnancy or miscarriage after stopping the depot shot while the body is trying to regulate or get back to normal?
No. Again, one of those things you'll hear out there, right, is try not to, if you're going off the pill, for example, gal wants to get pregnant. She's been on the pill for 5 years. She's going to stop it this month. They might tell her, don't try to get pregnant for the first few months. Wait before you try to get pregnant. And of course, that makes us think, oh my gosh, there must be something wrong with the pill, or, something that could be dangerous to a pregnancy or what have you. And that's not the case at all. The reality is when you are on a depot shot or you're on the pill, of course, you're not ovulating at all, right? Not ovulating at all. You're actually just simply taking in estrogen and usually a little bit of progesterone, and that's kind of faking your body out so you won't cycle hormones and you won't ovulate and therefore not get pregnant, birth control. What happens sometimes when you go off that is you will hyperovulate off of that. So your body's like, okay, let's go, everybody, let's go. And you might ovulate a couple of eggs at a time. Now, again, a lot of people might say, I wouldn't mind twins at all. Or even what higher than that. But the reality is anymore, we don't really like that. We really like, in the medical field, singleton pregnancies. That's the healthiest. I know it's maybe more economical to have twins, but that's not what we're always wanting to go for here. So singleton pregnancies are the way to go. But that's what the case is coming off of that stuff isn't going to make you miscarry, doesn't damage eggs, doesn't change the uterus. Now you may take a few months to get back into rhythm, right? You might find you go off the pill and you're like, what the heck? I was perfectly normal before I went on the pill, and now I'm all over. Well, just got to give it a minute. Got to get back in the rhythm of things, So that might happen, and you might not get pregnant because of it. But again, you wouldn't get pregnant and miscarry or have a chemical because of it. Mm. Does that make sense?
Yeah.
Okay.
We have one saying, I was taking progesterone, and now my doctor wants to see if my cycle comes on without the medication. Will my cycles come back on natural timing, or like I was taking progesterone?
Okay, so I'm probably going to assume, are you meaning Provera? because Provera is a progesterone. And for us PCO gals, you know, they want us to have a period, you know, I don't know, back when I was fertile of that age, they might want us to have a period 4 times a year. So they would give us Provera, you know, you would take 5 to 10 days worth of the pills. And as soon as you stopped, within, you know, a couple, 3 days, you'd end up getting a period. It's kind of a way to clean things out, you know. So that's progesterone or Provera. It brings on periods. Now they are fake periods. They're not real periods. Okay. A real period happens because your own natural progesterone drops because you didn't get pregnant. It's the dropping of the progesterone. So I got to give it a day or two, because when your body goes, whoa, what happened? There's no progesterone around. Okay, we're not pregnant. Let's bleed. And there's a period. Well, if you don't do that, like I didn't do that on my own. So I would take progesterone for, say, a week every day. Then I was done. So on day 8 and 9, there was no more progesterone. My body still went, oh, no more progesterone? Okay, let's have a period. Well, that had nothing to do with getting pregnant. That had nothing to do with ovulating. It had nothing to do with any of those hormones. It was just the progesterone. So progesterone doesn't bring on ovulation or anything like that. That would be drugs like letrozole or Clomid or Seraphine. Those drugs maybe will cause you to ovulate, but not progesterone. Progesterone supports a pregnancy. Progesterone happens in the second part of our cycle, not the first part.
Okay, and then we had a question. I had an implant, and a few months later, I had an ectopic pregnancy. I'm 20 and haven't had any regular periods. Is that normal?
Okay, well, I'm not sure if the question is about the ectopic part or if the implant was taken out and then she got pregnant. I'm not sure. I mean, I can tell you this much. The ectopic has nothing to do with the implant. Nothing. You ovulated. I'm not sure if the implant was removed and then you ovulated and had an ectopic. But again, the implant that you had would have nothing to do with the ectopic. If you had the implant and got pregnant, well, the implant didn't work. But the ectopic meant usually what it means is you got pregnant in your tube. Of course, we all get pregnant in our tubes. That's normal. What also is normal is that little embryo keeps moving down the tube and drops into the uterus. Mm-hmm. It takes a whole bunch of little fine hairs in that tube to push it along. So that's a very intricate system. And sometimes it doesn't work. And sometimes if a woman's had a history of some kind of pelvic disease like chlamydia or something like that, you can have a little bit of scarring left over from an infection. You know, I got a cut on my finger and it got infected. I have a little scar there now. Okay, well, the same thing can happen in our body. You could have had a chlamydia infection. You got a little bit of scarring in the uterus and in the tubes. So now my little, cilia friends don't move down embryos all that well. I got pregnant in the tube, but it implanted in the tube. That's the bad part. Again, you do conceive in the tube, but you don't want to implant in the tube. But that would have nothing to do with the implant.
Okay. And she did add follow-up that she had a tube removed.
Okay, there you go. So it must have been. And again, to implant in a tube is usually to do pretty much permanent damage to that tube. And if the tube isn't removed, you are now just more likely to have that happen again. So the docs will do the right thing and remove the tube. Now you could theoretically still get pregnant on the other side, if there wasn't scarring, hopefully that's not an issue.
Okay. What causes healthy couples to not conceive after 2 years of trying?
Well, something's wrong. Something's wrong. Right. So what does that mean? Well, it could just mean nothing is wrong with you two biologically, but if you're not having sex during ovulation, and people actually use that, it's called the rhythm method. They use it as birth control. So you could be having sex for 2 years, and if you're not good at it, meaning timing-wise, well, you're not going to get pregnant. There's not a darn thing wrong with you or him. So is that the issue? You know, were we doing, now if you say, no, look, we're 32, I've been doing OPK tests religiously, periods are clockwork, you know, we have intercourse a couple of times every month, and you're 32, in 2 years you have, something's wrong with one of you, something's going on. Again, oftentimes the easiest thing to do is let's take a look at the sperm, you know, because men sometimes, you know, they're not perfect, even though they think they are, they're not. And they will have sperm that you need a lot of sperm. I mean, you know, a man ejaculates in you, you know, you ovulated over here on the left. Well, right away, half of his sperm is going to the right. Right away, I lose half of his sperm right off the bat. Half of his sperm don't even get in through the cervix. Some do, but they're driving crazy and going backwards, you know. So it's not a lot of sperm that gets up to that age. So you've got to have, you can't, you know, if you have a real low sperm count, that's going to be a problem. I mean, it might take you 2 years to get pregnant, or you might have to have help. Or, you know, this little gal that just wrote us, I bet she didn't know she had a tubal issue. How do you know? I'm sitting here. How do I know if I have a tubal issue? You don't. There's no symptoms. There's no over-counter test to take. I will tell you, if you were ever diagnosed with chlamydia, you want to really think about it. But you don't know. You have to actually have a test done. So now, if this healthy couple says, we have looked at his sperm, I've done the hysterosalpingogram, the HSG test, the dye test. My tubes are both open. He's got a wonderful sperm count. We're doing it right when we're supposed, then I'm at a real loss, unless you're 40 or something. Then it could take a couple of years, you know. So otherwise, there's something going on there. You know, something is going on. Not sure what it is, but something is going on.
Okay. What about Clomid possibly causing a miscarriage?
Generally, Clomid is taken in like the first week of your cycle, and for 5 days or something, and hopefully it's going to make you ovulate, you know, within another 5 days or something like that. If you were to get pregnant from that and actually implant, then again, Clomid did its job, that you're fine. But Clomid in itself, Clomid's only going to make you ovulate. And as our women out there who ovulate every month know, just because I ovulated doesn't mean I get pregnant. So again, Clomid isn't necessarily going to cause you to miscarry more often, though there are some thoughts about Clomid for the long term. Clomid does its job, but it isn't something you want to keep taking month after month after month after month. You don't want to take it more than 3 months in a row. It can have an anti-estrogenic effect. And estrogen we need because estrogen causes the lining to grow in our uterus for that baby to implant in. So, but, you know, docs know this, so nobody usually is going to prescribe it for you generally longer than that. But no, it wouldn't cause you to miscarry. You might not respond to it. Again, that's not Clomid's fault. I didn't respond. I did, 3 cycles of Clomid, and I never once grew a follicle. So not its fault. That's my fault.
We had a comment from someone saying that they're creeping up on 3 years and all normal test results. And I just wanted to plug in here that we did have a panel on unexplained infertility. So make sure you check that out. And also make sure you schedule a consultation with someone like Nurse Linda, or we have many consultants in our app, or your specialist, because as Nurse Linda said, there's something that needs to be discussed there. Even if it means you need to take a break, maybe you're overstressed. We had a panel on that last week. But yeah, definitely make sure you're receiving that support if you feel like you're doing everything you can and you still don't know what's going on.
And of course, the big question there is how old, right? Mm-hmm. Because again, if a 24-year-old's asking me this question, I have one answer. If a 44-year-old's asking me this question, I have a completely different answer. So that age thing is really important when we ask those kind of questions too.
Yeah, there's so many factors like you're talking about, Nurse Linda, that people may not even be aware of that can come up and conversations and further testing.
That's right. That's right.
Someone's saying they've been TTC for years, have a great OB, ovulating on letrozole, but they keep getting chemical pregnancies. They're still taking medications, and they're wondering any suggestions for preventing chemical pregnancies.
Well, 2 questions. Do we know how old she is?
I don't think I have a year. She said she's been trying for 7 years. Let me keep looking at her.
So that would be one thing, is age, her age. Because again, same as like I just said, I could have 2 separate answers there. And what to do to prevent chemical pregnancies. You know, we 32. Don't know exactly. Sorry?
32, sorry.
Oh, only 32. Wow. So if we're only 32 and we've been trying for 7 years, did you say?
Yes.
And I'm assuming we're doing the ovulation predictor. We're tracking everything and we're having intercourse and he checks out and she checks out and we're not, but did you say she was on letrozole?
Yes, ovulating on letrozole. And she's continuing to take meds.
Right. So because keep in mind when we talk about letrozole or Clomid, those are drugs that cause you to hopefully ovulate. But if you already ovulate, these drugs aren't known to be beneficial to you. Like I tried them because I wasn't going to get pregnant on my own. I wasn't ovulating. I needed some assistance. But if you're getting pregnant on your own, taking these medications isn't something you need to do. Could they cause you to ovulate maybe a couple of eggs instead of 1? Maybe. But again, you don't want to be putting these drugs in your system if you're ovulating perfectly normal. Sometimes, you go to your doctor, and this could be a woman taking her child to a pediatrician, or you go to your OBGYN and you're like, look, he's coughing. I need a prescription. Well, wait a minute, what if it's viral? But people expect that. I go to my OBGYN and I say, look, I'm trying to get pregnant, help me out. Well, a prescription is what they think they're supposed to have, and so sometimes docs do that. Certainly I've seen that where they put women on these medications and they don't really need to be on them. They just feel like they need some kind of interventions kind of thing. But that is really unusual that neither partner has anything irregularly wrong with them. The doc puts her on letrozole anyway. And after 7 years, she's not getting pregnant when she's, doing everything normally. I don't understand why an OBGYN would just sit on that. We either need further testing or... I'm sorry?
Oh, she clarified a couple of things. She said, ovulating only on letrozole. Clomid didn't work. She did 8 rounds of it, and she's been taking letrozole since July and keeps getting chemical pregnancies.
Okay. And we don't know how many when we say keep getting. 2, 3, 4, did she?
I think she did. Let's see. A lot of getting lost in the comments here.
That's all right. That's right. You look at that. Again, most chemical pregnancies, when we lose a pregnancy, they're either due to the egg, and again, I'm going to say fault, the egg's fault, the sperm's fault, or the uterus's fault, or some combination of that. So why are we miscarrying? If you only ovulate on letrozole, then obviously you must have some diagnosis. So when we said everything tests normal, well, it must not if we have to take medications to ovulate. So we do have some kind of underlying diagnosis there. I don't know if it's obviously like PCOS or what it is, but again, PCOS wouldn't just in itself lend us to miscarry. Most often it's the egg's fault. That's why. It's just, it hasn't happened yet. It's not anything to try to fix. But again, if somebody's got at 32 years old and they've gotten pregnant, 4 times and they've had miscarried every single one of them with no live births in between, that's an issue. I mean, that's something to look at when you're only 32. I'd have to start looking at, is there something going on with the uterus that we're not staying implanted? So there's further testing that can look at that. There's blood work that can look at immune issues that don't allow us to implant, but again, I'm not sure how many miscarriages.
Yeah, I didn't get the answer, but I'm getting more pieces. Okay. Said PCOS since 13, endometriosis, surgeries to remove cysts, but her eggs look great.
Well, unless you've had IVF, you have no idea what your eggs look like. None of us do. Sperm we can look at. I can tell you what your husband's sperm is like when I see it, but you don't see a woman's eggs. So we have no idea what a woman's eggs actually look like until we take them out of her body. So I can never say somebody's got good eggs unless they do IVF and I can look at them. One. There was something else you said in there. PCOS since 13. What else? Endometriosis. Okay. So endometriosis, and now this gets tricky because different physicians believe different things. One of the physicians I worked for felt very strongly about the immune system playing a role in miscarriages. There's a whole school of thought about this. People have to do intralipid or IVIG infusions. One of the reasons they have an immune system that doesn't allow them to get pregnant is endometriosis. Endometriosis, of course, is the uterine lining, which is supposed to be in the uterus, but it gets out, escapes out through the tubes usually. And those little endometrial deposits, they're special cells. They might land on, could be anywhere. Could be the colon, could be an ovary, could be the outside of the uterus. And these specialized cells, doesn't matter where they are. When your hormones start cycling like they're supposed to, or if you're on medications and you grow a thick lining, well, all of those little misplaced deposits all grow a lining too. And of course, every month when you have a period, all of them shed as well. Usually women with endometriosis have horrific cramping and pain with their periods, and this is why. But the school of thought says that the immune system kicks into high gear to try to clean up all those deposits that are everywhere. You can never get rid of endometriosis. It's even if you get it lasered off, it's going to eventually all come back, kind of thing. So sometimes it's thought if you have endometriosis, you might have that kind of immune system that while it's in there getting rid of all the bad stuff because it's foreign and not in the right place, technically an embryo is half our husband, right? So it's theoretically foreign to us. But of course, we get pregnant and we stay pregnant in life. Unless you've got one of these, kick-ass immune systems that attacks things, again, it tends to be an overdrive. You're probably really healthy. You hardly ever get sick because you've got one of these, on alert immune systems. But sometimes that can cause you to miscarry. And again, I don't say that's a popular school of thought, but it is a prevalent school of thought out there that endometriosis can lead to an immune system that you end up experiencing more than normal amounts of miscarriages.
Okay. Let's see if we can do a couple more here.
I know I'm giving some complicated stuff, but you never know. I throw it out there, see what sticks.
I was hoping we could get endometriosis in there somewhere, so that was awesome. Yeah. Let's see. I have one that's kind of a long case. We might come back to that one. I know we're trying to stay a little more general, get a little specific today, but let me see what else we have here. That's kind of specific too. Let's see. Let me see if I can maybe make this into a question here. Okay. Someone's talking about being TTC for multiple years, male factor due to count, husband on Clomid, and then she's on letrozole. She's asking if they end up with more than 3 or 3+ good follicles, should they skip IUI or TI this month, or would our odds still be pretty low given they haven't had success in over 48 cycles.
Wow. Yeah.
Yeah, that's pretty.
Okay. So yeah. All right. So he's on Clomid. Of course, men are on Clomid because, men and women, we all have the same hormones. They have a little bit of a different focus, but we all have the same stuff going on. Clomid will help a man improve his sperm. But again, a man doesn't take Clomid. Like if I take Clomid, well, not me, but a normal woman, she takes Clomid, she'll ovulate, a week later. It doesn't work like that with men. Remember I said it takes 2 to 3 months for men to make sperm. So if Clomid's going to improve things, it's going to take 2 to 3 months before that happens. But that's why a man would be on Clomid to improve his sperm. She's on letrozole to help her ovulate. That's tricky. See, again, I refer back to, my experience. I didn't respond to Clomid or letrozole or any of that, right? So I had to go to injectable medications next. Well, I went to those to do IUIs, and boom, now all of a sudden you start growing up in your PCOS, a whole bunch of follicles. Now those get canceled. Can't do Clomid, can't do IUIs. I have no choice but to go to IVF. So this is similar in that, what do you do if you have 3 follicles? Well, do keep in mind, whether or not you've been not successful for 48 months, trust me when I tell you, could you ovulate those 3 eggs and could you get triplets? Absolutely you could. And once that happens, there's no going back on that. I know some women feel like, oh, triplets. Oh my gosh, there's a whole Facebook page and the babies are so cute. And have you seen the strollers? And it's adorable. And they just think ready-made family. And isn't this great? And no harm. I've got a mom who will help me and my husband's great. And you don't want to have triplets. And again, this is the nature of the internet, right? Is you hear and see very filtered things. You don't hear about the mom who got pregnant with triplets and in the shower at 19 weeks, she lost them. I hear about that. I hear about many, many stories like that. That mom doesn't go out there and post and brag about that. So instead, you see only the skewed results of all the happy moms with the Gerber babies when they have triplets. But the reality is it's a nightmare. You have to decide if you want to try to carry 3 and what if, you end up losing all of them or do you do selective reduction down to twins or a singleton? And there's risks there. And then there's emotional, mental health risks with that as well. So again, trying to get pregnant or getting pregnant with 3 is a nightmare. There's no other way to say that. So yeah, oftentimes when you see that many, if they see that many follicles, they think you're going to ovulate. It's a chance, but it's a risk, right? It's like anything else. It's just a risk you take and you have to be aware of that risk. Sometimes people, and I had to deal with this in IVF with transferring embryos. Should I put 3 embryos in? I mean, why not? I haven't got pregnant in my last 4 IVFs. I mean, come on. And we put, 4 in and then she gets pregnant with triplets. See it happen all the time, So I'm just here to tell you what you don't think will happen will probably happen. So yeah, I can't tell you what to do on that, but just keep in mind what the risk is.
Okay. Well, thank you. This is, oh my gosh, so much information. I've learned so much today. This is great. A lot of these, I'm like, I have to go back and watch. And thankfully I get to read through them again later too. We're about out of time. Can we squeeze in one tracking question?
Sure.
Let's see. Okay, they said, I'm new to ovulation sticks and have been using the Premom for 3 months and have not peaked in 2 weeks. And the numbers are really low and it's day 23. They've been bouncing around in the 0.2s. Does the TC ratio go to 0 after ovulating, or is the persistent 0.2s indicating I haven't ovulated?
Well, again, the big thing to confirm ovulation is the basal body temperature. It's a simple thing to do, and that will confirm and let you know. I love when I look at charts and somebody has done both the kits, the sticks, and the temperatures, because I don't even need to look at numbers. I can just tell you based on what those look like, those shifts look like. I can tell you if you ovulated or not. This sounds like what a lot of my consults are like, where again, it's the same kind of thing. Seems to them like everything is, on point. We're just not sure what's happening, and it turns out maybe we're not doing the P sticks twice a day. Again, you don't have to, but it sure helps if you do them twice a day. Or we're not having intercourse like I said, I like to shoot for the 3 times, right around when we ovulate. So it's usually some really simple things like that. But of course, that's the beauty of Premom, is they've got these great consultants. There's a whole bunch of us, and any one of us can look at your charts with you and help guide you so you don't waste any time. Or like I said, there might be some real advice we could give you that really will help you out.
Okay. Thank you for squeezing that last question. I know we're right at 8:30.
No worries. No worries.
Linda, for another fantastic presentation. And thank you, everybody who participated live. I think we had like up to 30 something, which is fantastic.
Nice.
If you like this evening time, because if this is the best time for you, we'll see if we can get more of these in for you. So keep telling us what's working.
Remember, thank you, Terry.
Oh, you're welcome. And remember, you can find Nurse Linda right in your Premom app. If you go into more, schedule consultation, you can find her under registered nurses and get your questions answered.
It'll help. Absolutely.
And we'll see you again soon. Have a wonderful night.
Guys. Take care, guys. Bye-bye.